we think that what's happening is that the breathing activates these pathways through the vagus nerve. And one of the ways that we measure the activity of the vagus nerve is called heart rate variability. And it's a rather complex mathematical formula that's used starting with your heart rate. And it is measuring the rate of change of your heartbeat. When we breathe in, what happens to our heart rate? Does anybody know? It goes up, right. And when we breathe out, what happens to our heart rate? It goes down, right? So this is what's called normal sinus arrhythmia. You breathe in, the heart rate goes up. You breathe out, it goes down. And this is a mathematical calculation based on that. Depending on how that comes out, that will tell you something about how active the vagus nerve is. So that's how it's measured in most studies. Now, Dick talked to you a little bit about this earlier, but what you're seeing here is this is a person breathing at about 15 breaths per minute. That's sort of a normal breath rate. And the difference between breathing in and breathing out is only about 4 heartbeats between breathing in and breathing out, okay? Now, if you get the person to breathe at 7.5 breaths per minute, what you see is this beautiful sine wave, and now there is a greater difference between breathing in and breathing out. Much more difference between the rate of your heart when you breathe in and breathe out. Now, if you get the person to breathe at 5 breaths per minute, now there's a huge difference. It's about a 40 beat difference between breathing in and breathing out. And this would look like the way infants' heart rate variability is. Now, they don't breathe this slowly, but their heart rate variability has an enormous difference between breathing in and breathing out. And part of that has to do with the flexibility of their system and also their blood vessels, which dilate quite a bit and contract with each of their pulses, okay? As we get older, the walls of the blood vessels get a little more rigid, so they kind of move in and out like this. But when you're a baby, they're moving like this. And that flexibility is one of the best predictors of health and long life, okay? So if we can get you to breathe at 5 breaths per minute, you're going to have a much healthier heart rate variability. And your blood vessels are going to start doing this, okay? So you're going to be, your cardiovascular system will be functioning as though you're much younger. The other thing that happens with this rate is that with each breath you take, your body absorbs the maximum possible amount of oxygen. So you have to work much less. It's much less work breathing at 5 breaths per minute, and you're absorbing much more oxygen with each breath.